Now, what you should know about cardiac arrest is that every second counts to help save the life of a victim.
Now, a man identified as Dan slumped and died while dancing at a traditional wedding. Now, this incident reportedly happened in Borokiri axis of the old Port Harcourt township area at a traditional wedding reception between his relative from Ataba in Rivers State.
Now, the man, according to the video you're about to see, was believed to be the community chief from Ataba in Andoni local government area of the state. Now, let's tell you that this video you're about to watch is quite disturbing.
The party is over. The party is over. This man don't finish up. Hey, Jesus. Send the follow. Is there a doctor in the building, please? High tension. Doctor, check out again. Check out where they go on alcohol. Check out where there's going to be alcohol. Then double up. Everything not going to be true falling follow. Not true follow.
Unfortunately, the man in that disturbing video died shortly afterwards. Now, there has been a lot of questions after that video surfaced on social media, such as, couldn't anyone perform a CPR on him as at the time? What could have been done to keep him alive?
Now, to really explain and expand on these issues, what individuals can do in such a situation, we have joining us on Breakfast Central to discuss first aid and emergency care, none other than Dr. Tosin Osikoya. Welcome to Breakfast Central, Dr. Tosin. Good morning to you.
Good morning, and thank you for having me.
Good morning. All right, so permit me now to go back to that sad incident, that video we just watched. What could be responsible? What could have been responsible for the sudden fall, gaps for breath by the late community chief?
The thing is, when someone collapses, I would define collapse as unconsciousness due to an accident or an illness. We are not supposed to know what the real cause is because it has no bearing on how we help that victim. Only the medical professionals should know that and design their care based on that. But as bystanders, once we see that there has been a problem, the person has fallen down, the person doesn't seem to be moving, we need to go there and assess quickly and give him the required help. In this situation, using this video, we're just talking generally. What we will find out first is this person breathing? Because breathing is what determines our next step of action. You have to understand that somebody falling that way could be from different reasons. He could have fainted, he could have had a heart issue, he could have had a seizure. We don't know. Ours is to go there, make a quick assessment. Is he breathing? Then make a determination of what next to do. And that will be CPR if he's not breathing.
Okay, so for this particular situation now, because it could be anything. It could have been anything.
Yes.
Yeah. What individuals can do is to first, check whether the person is breathing or not. Is there any other thing that, any individual, whether you have medical background or not, can do?
Okay, the thing is, once you've assessed, now there is a mnemonic we use for anybody that has collapsed. We call it doctor's ABCD. It changes depending on the scenario in which you find yourself. So D is for danger, R is response, S is send for help, A is airway, B is breathing, C is CPR, and D is defibrillation. all of these steps flowing into each other so that we can give the person the best help possible. Understand that for somebody who has collapsed and needs medical care, the arrival of medical professionals is very important. So they need an ambulance to come there or they need to get to the hospital. But what do you do in the time that you have? Because they will not get there to you in the next 10 minutes, let's say at the best. So in 4 minutes, brain damage can start. That's why you need to quickly make an assessment if he's breathing or she's breathing. Because if somebody is not breathing, oxygen is not getting into the body to go around the body and circulate. Because what the body needs every second of its existence, it's oxygen. So if you make a check and the person is not breathing, if you dispense with death and danger, you dispense with response, I don't really want to go into all that because it's actually a skill you learn. You have to start CPR. CPR is cardiopulmonary resuscitation. It's a skill that is learned. But even untrained people can do something because doing something is better than nothing at all. Before you start CPR, however, you must send for help. Sending for help is calling for emergency care. And if you do not have emergency care where you need to get transport immediately so you start going to the hospital. You now do CPR on your way to the hospital. CPR involves chest compressions and breathing for the individual. But you don't have to breathe for the individual if you're not comfortable, especially in the era of COVID and all the infections around. Do chest compressions, which is what I would have advised in this scenario.
All right, doctor, now looking at the scenario and looking from what you've explained to what a layman can do in that kind of scenario, another thing that usually happens in similar situations like that is you have crowded people. That means you have people crowding that victim at that point in time. And the very first thing you said is to ensure that that person is breathing. How do we manage the situation? How do we calm the relatives who are probably emotional and, you know, they're in a state of in an unstable case state at that point in time? How do we manage that scenario as a whole?
One thing I find among Nigerians, if there's a medical emergency, is that we want to help. We come from a good place, that let's see what we can do. But most of the time, the actions we take might actually cause more harm. So it's very important now, number one, to even do a good assessment, is that everywhere people should be away, bystanders should be away. It's also you don't even know what caused the person to collapse. Could it be a dangerous situation? Could there be a hazard around that caused that person to collapse, and you are now going to run in there and also get yourself mixed up in that situation? So for that video specifically, if people were trained, if people had an idea of what first aid is and what the possibilities could be for this emergency, they will push people back, give conduct an area around so that somebody could make a good assessment of what this person's condition is with regard to response. Is he conscious or is he breathing? You have to listen for breath sounds. In COVID era now, we don't even advocate that because the virus is spreading around and you can easily get it from inhaling somebody's breath, or you even passing it on to the victim and adding more to his woes. So actually now in COVID, we actually don't ask for you to do breathing. You said start chest compressions first, and that's 30 compressions to 2 breaths. It's easier said than done, and that's why people should understand that they should learn first aid and learn CPR, because that skill will help you in that kind of situation. So get people away, explain to them this person needs this help, and they being that close cause more harm. Assess the person correctly, because the person might have been breathing and all they needed to do was place him in what is called the recovery position, such that vomiters or saliva will not get back into the lungs or the airway and flow out onto the...
All right, Doctor, before we let you go, it was reported that he suffered cardiac arrest. Now, who can suffer cardiac arrest? Quite important.
Anybody, honestly. Cardiac arrest is just usually a final sign of something, and usually it's coming from heart disease. So heart disease is the common reason why somebody will go into cardiac arrest. Cardiac arrest just means the heart stops. Arrest, stop. It doesn't pump again. It's not circulating blood, and usually it's from a electrical impulse failure, usually what we call abnormal rhythm. But that abnormal rhythm arises from different things. It could be a heart attack, it could be a diseased heart, anything can cause an arrest. That's why our own is not for you to know what the diagnosis is. Our own is that please ensure that this person can preserve their life until medical care can take over for this person.
All right. Thank you very much, Dr. Tosin Osikoya, for coming on Breakfast Central today and really explaining quite a lot for us in terms of what we can do to render first aid, and especially when it comes to emergency situations. Enough of the pour and water.